All right, today we're going to be testing for the 12 cranial nerves. This is going to be my patient. Could you name your name and date of birth?
Stephen Blank, January 5th, 2001.
Awesome. So the first cranial nerve we're not going to be doing, that's going to be taste. That could be done by a provider usually. For the second one, we're going to go over to a Snellen chart, and we're going to have him stand 20 feet away from the Snellen chart. He's going to read the lowest line he possibly can, and then if he gets more than 3 wrong, he's going to have to move up to the next line, and he's going to be looking with both eyes. Then he's going to cover one, then cover the other, and so we're going to get an accurate representation of what his vision is. We're going to be hoping for 20/20 vision, and then we're going to move on to the third cranial nerve here, and we're going to say that the second one was good. And we're going to do a star pattern. You're going to follow your eyes with a pen. And we're looking for any skips in his eyesight. We're just looking if the pupils are skipping along or anything like that, but everything looked good there. And now we're going to look for his pupillary response. Looks good, and then we're going to put in the middle so we can see if they both react to light only when one's stimulated. All right, and they do, so that's good too. So we're going to move on to the fourth now. We're going to have him follow the pen light in, watch it with both your eyes, goes into his nose, and you saw both his eyes cross, so that was good. So then we're going to move on to the fifth, where we're going to test his jaw strength. You can open and push, and you can push back too. And then, so that was good, and we'll go on to the sixth. The sixth is where we're going to be testing. It would be testing the same thing we did in 3. So we saw that his eyes move well there, so we're going to say 6 is good as well. 7, we're going to move into, we're going to have him smile for us. Going to have him frown, puff out his cheeks. All right, that all looked good too. And then we're going to have him repeat a word to us. So we're going to say football.
Football.
All right, and that was a 2-syllable word, which is what we want. And then we're going to move on to 8, where we're going to do the whisper test. And so I'm going to cover one of his ears.
Soccer.
All right, now I'm going to go to the other side and do it.
Basketball.
All right, he got both of those right, so 8 looks good as well. And then we're going to move on to 9, where we'd look for him to say ah.
Ah.
All right, and if we had a tongue dispenser, we could get a gag reflex from him to see that 9 is good too. And then we'll move on to number 10, where we already know, because we had him the whisper test and we assess his speech with a 2-syllable word, that he has no hoarseness in his voice, so that's good as well. So 10 is good. And we'll move on to 11, where we're going to have him look left and right. Nope, with your whole head. Left, right. All right, up, down. All right, good job. And then fight my hands. So that was good too. So 11 is good as well. And now 12, you're going to stick out your tongue. Go left and right. All right, so that was good too. And then all the 12 cranial nerves looked good. Other things we could do during this test that we would have seen already during the full assessment is if his posturing, gait, how well he walked, and things like that. But we're going to say that all that looked good in the full assessment. So all his 12 cranial nerves are intact. So he did a good job today. Thank you, Stephen.